The final procedures we will discuss are nail trimming, ear cleaning, eye cleaning, and expressing the anal glands. Trimming nails on dogs and cats is a daily occurrence in every veterinary hospital. Many owners will inquire as to how often their pet should have its nails trimmed. There is no simple answer to this question. Having their pet's nails evaluated during an examination is the very best way for them to know. A pet's nails continually grow throughout their lifetime. As they dig, scratch, and walk on hard surfaces, they wear down the tips of their nails. Prior to domesticating these animals and bringing them into our homes, it was not necessary to trim their nails, as they would naturally wear them down. Today's indoor pet will likely require you or their owner to assist in maintaining short nails. Untrimmed, a pet's toenails are likely to either break off or become ingrown, both of these being very painful to the pet. Before discussing how to trim nails, let's review some basic anatomy. Most dogs possess 4 nails on each paw, with a possible dew claw on the inside of each paw. Dew claws are possible on any foot, but are likely to be found on the front feet. You should be extra careful not to miss trimming a dew claw when performing a nail trim, as these nails get little contact with the ground and are often very sharp and in need of trimming. Some owners will opt to have the dew claws removed when their dog is just a few days old. The anatomy of the toenail is consistent regardless of its location and color. Within the hard shell of the nail exists a core containing a blood vessel and a nerve. This sensitive area is called the quick. When examining clear or light-colored nails, the quick will be obvious because of its pink color. The region of the nail beyond the quick can be trimmed without causing the animal any pain or bleeding. When the quick is not visible, as with all dark-colored nails, the location of the quick must be approximated. Observing the underside of the nail for a notch or hook is often a helpful indicator for identifying an area where the quick is not present. When trimming a pet's nails, it is important to remember that if the pet's nail bleeds or the pet shows obvious signs of pain upon cutting, then you are likely in the quick area. When this happens, you will not want to trim as close on the next nail. The most common tools for trimming the nails are the Resco guillotine type nail clippers and the large plastic gripped nail clipper. The most important thing to remember about the nail clipper is that they should always be sharp so that they cut the nail rather than crush the nail. Using clippers with a dull cutting surface will produce pain for the pet. Once you have selected the appropriate clipper, you are ready to begin. Be sure to have the pet properly restrained, because many pets do not like their feet handled, and you never know how a pet will respond when they are in pain. It is always better to conduct nail trims with the help of another assistant whenever possible. With one hand controlling the paw, guide the clippers over the toenail to a point just outside the quick. Cut the nail quickly so as to minimize any squeezing of the nail. When learning to cut nails, especially dark nails, it may be helpful to begin cutting further out away from the quick and clip closer with subsequent cuts. By evaluating the pet's response and examining the appearance of the cut surface, you will likely detect when you are approaching the quick. When a nail is cut too short and begins to bleed, don't panic. This is not a serious problem and can be readily corrected with the aid of septic powder or a cautery stick. Both of these agents work by chemically cauterizing the bleeding vessel. The silver nitrate cautery sticks tend to be somewhat uncomfortable when applied to the exposed nerve of the quick, so adequate restraint should be in place to prevent a bite response. Be careful not to touch the tip of the silver nitrate stick, as this causes your skin to discolor for several days. It is the goal to cut the nails as short as possible without hitting the quick. With time and experience, you will learn to recognize how much to cut off. Cats will also occasionally need their nails clipped. The quick is generally quite obvious and can be easily avoided. By gently squeezing the cat's pad, the toenails will become more prominent, making it easier to clip the nails. Cat nails are more likely to splinter when cut. This can be minimized by using sharp nail clippers. Next, we will discuss basic ear care. We will limit the ear care discussed in this tape to cleaning the non-infected ear, as might be done after a pet has been bathed. Various advanced techniques for cleaning and flushing out the ear canal have been developed, but will not be discussed in this overview. Ear infections and other diseases of the ear are quite common and will need the direct attention of the veterinarian. It is very important for a veterinarian to examine ear conditions prior to cleaning, as they will need to visibly assess and possibly run laboratory tests to determine the cause of many ear conditions. Therefore, in situations where you notice the inside of the ear to be red or painful, consult with your veterinarian prior to cleaning the ear. An overview of the anatomy of the ear is necessary in order to prevent injuring the delicate internal structures of the ear. The ear canal of the dog and the cat are similar except for size. The key anatomical structures for you to remember are the vertical ear canal, the horizontal ear canal, the eardrum, and the inner ear. The vertical ear canal is most always visible, unless obstructed by a floppy ear or hair in the ear canal. A normal ear canal should not be red and should be relatively clean. Some wax and environmental debris may accumulate in this area and will benefit from regular cleanings if done properly. The vertical ear canal turns abruptly inward and leads into the horizontal ear canal. The horizontal ear canal is not visible without the aid of an otoscope, and therefore one should not attempt to insert physical objects into this area. We will allow the gentle flow of cleaning solutions to loosen and wash debris from this area. Just beyond the horizontal ear canal is the very sensitive eardrum and inner ear. Where there is excessive hair in or around the ear canal, it is beneficial to clip or pluck the hair prior to cleaning. Maintaining the ear canal free of hair will also aid in the prevention of ear infections. In order to remove hair from within the ear canal, you will need to pluck the hair in small tufts with your fingers or with a pair of forceps designated for the purpose of plucking hair. This process is relatively non-painful as long as you don't attempt to remove too much hair in one pull. When using forceps, it is helpful to twist the forceps around once or twice to minimize the hair slipping from the grasp of the forceps. Be careful to grasp only hair, as grasping the skin is quite painful to the dog. Ear powder will also allow you to better grasp the hair in the ear canal. Hair surrounding the ear opening is probably best removed with electric hair clippers. Once the hair has been removed from the canal and surrounding area, you are ready to begin cleaning. The proper selection of ear cleaning solutions should be directed by your veterinarian. They will likely select products that are designed to clean, disinfect, and dry the ear canal. Residual moisture from swimming and bathing are typical contributors to ear infections. Encouraging pet owners to regularly clean their pets' ears with such solutions will dramatically reduce the chances of ear infections from occurring. The cleaning solution should be liberally applied to several cotton balls. They are then used to wipe out visible debris in the vertical ear canal and on the ear flap. If the ear canal is large enough, you can place the cotton ball down into the vertical canal on the tip of your finger, being sure not to lose hold of the cotton. Your finger is too large to get into the horizontal canal and will assure that no damage is done to the sensitive internal ear structures. A cotton-tipped swab can be used to clean the vertical ear canal of small dogs and cats. Keep the swab in an upright, vertical position, and this will prevent accidental injury to the eardrum. Another technique commonly used is to squirt a small amount of cleaning solution directly into the canal. A gentle massage at the base of the ear will aid in loosening up debris in the ear canal. This can then be followed by removing the loosened debris with a cotton ball or swab. Continue to wipe out the canal until the cotton appears to come out clean. It may be necessary to repeat this process if the ears are especially dirty. Both techniques seem to work well if done gently and with proper solutions. Solution that remains in the ear canal does not cause any harm, as it will evaporate much quicker than water. Any medications you are directed to place into the ear should be done after the ear has been cleaned, not before. Cleaning debris from the corners of a pet's eyes is quite simple. Moisten a cotton ball with water and gently wipe the debris away from the eye, being careful not to touch the eye itself. As with the ears, if the eyes appear red, irritated, or have a mucousy discharge, you should consult your veterinarian prior to cleaning them. Cleaning out the dog's anal glands may be part of your grooming responsibilities. We will overview one technique for expressing these glands. The anal glands, or anal sacs as they are sometimes called, are located on either side of the anus in the 4 o'clock and 8 o'clock positions. The glands secrete a thick, nasty-smelling excretion through an opening on each side of the anus. This process naturally occurs every time a dog or cat passes a stool. The material excreted coats the stool, giving it a particular odor used by the animal to mark its territory. These glands serve no other significant purpose and are not necessary to the dog or cat. Occasionally, these glands will become clogged or infected and will no longer empty with each passing stool. When this occurs, as is most common in the dog, the gland or glands become quite full, and this becomes quite irritating to the dog. They usually react by either biting or licking at their anus or by scooting their hindquarters across the ground. If these attempts to empty their glands are not successful, then veterinary intervention becomes necessary. Expressing the anal glands is the act of applying pressure on each gland until their contents are completely excreted. With an exam glove, cover the anal opening with a paper towel. A piece of saran wrap has been used here for demonstration purposes only, so you might better visualize the process. Squeeze and lift slightly the large area just below the anal opening, grasping an area wide enough to include both glands. Apply steady pressure. You should feel the glands release and the excreted material pass onto your paper towel. Continue to squeeze until both glands feel empty. The anal glands may be expressed internally by a veterinarian or veterinary technician if external expression does not prove effective. Professional groomers utilize the skills we've discussed and many more to artistically transform dogs and cats into adorable family pets. Such skills are learned through many years of practice and developing a keen sense of the physical characteristics of each breed. Your ability to perform basic grooming techniques like brushing, trimming mats and burrs, bathing, dipping, nail trimming, cleaning the ears and eyes, and expressing the anal glands will likewise make a significant contribution to the health of the pet and the happiness of the owner.